Senator Sifuna.
Speaker, thank you for your indulgence to allow us to skim through some of the reports that the committee has presented to the floor of the House. Speaker, in August of 2023, I attempted to bring a motion here in this House for the formation of an ad hoc committee to audit the state of infrastructure in our schools, and especially on the question of adequacy of infrastructure, given the government's policy of 100% transition rates. Mr. Speaker, whereas we all want our kids to transition 100% from the junior schools, the government had not, in my view, done enough to prepare the secondary schools for the influx of the learners. And the reports that have been put forward by the Committee on Health on the visits to county facilities, health facilities in these counties, is a demonstration, Honorable Speaker, that there is value in committees of this House being present on the ground to see for ourselves and not just to speak from Nairobi here. I had hoped that had that motion passed, Honorable Speaker, we would set up that committee, and maybe some of the things that we saw happening at Utumishi would not have happened. Speaker, it was horrifying just seeing the state of the dormitories, because we were told upwards of 200 kids were packed into one dormitory that was had a capacity of only 100. I saw pictures of beds actually being put in the corridors, and it was devastating, Honorable Speaker. At that time in August of 2023, I was told that the Senate did not have enough resources for us to support the activities of that committee. Now, if you balance what we would have spent, and I think the budget was about 10 million shillings to audit infrastructure in our schools, and the cost of one life, Honorable Speaker, then maybe we need to reconsider some of these things. I like when committees are allowed to do these audits in our facilities, because they bring out the truth. Reading through this committee, Honorable Speaker, the report of the committee, there is a thread in terms of the state of preparedness of our health infrastructure in the counties, be it Kitui, be it Kiambu. Honorable Speaker, it makes for horrifying reading. The story of overcrowded maternity wards is true in Kiambu, it is true in Kitui, it is true even in here in Nairobi, Honorable Speaker. That, for instance, on the report from Kiambu, 2 to 4 mothers were sharing beds, and there's a story that also in Kitui, and Senator Beth was telling me that in Kitui it might actually be up to 10 women on one bed. I don't know how they fit on a bed. Six. Honorable Speaker, this is the true state of our healthcare in this country. We are being told by the report of the committee, the observation that they made from pages 14 to 15 there, Honorable Speaker, that many of the young mothers were not even registered on SHA because of various reasons. They have stated, for instance, that some of them lack IDs. At a time when we are being told that even areas that hitherto had difficulties obtaining IDs, Speaker, that they have been expedited. This was the theme at the recent Madaraka Day celebrations in Wajir. So how is it possible that our young mothers in Kiambu are not able to access IDs so that they can register on SHA? I have seen a good recommendation from the committee there that we should find a way, SHA should find a way of registering these young mothers, even as government processes their registration documents, so that they are able to access this facility. Speaker, our Committee of Health also reported that they were denied access to data on child mortality in some of these facilities. And I don't understand why a committee of this House can be denied access to data, because we have heard separately that some of these counties and some of these facilities are actually understating the number of children who are dying after birth, Honorable Speaker. And we as a committee or as a House should put our foot down and say we need access to that data, Honorable Speaker, so that we can make proper recommendations to help these facilities. Honorable Speaker, there is also the challenge of SHA reimbursements. And, This is the reason why I say it is good for us to visit these facilities and to see for ourselves and to speak to our people. Because when you hear senior government officials speak, and we were in Naivasha with CS Duale, he will tell you that SHA is working 100%. Speaker, just reading through that report, you will see that this challenge is across counties. And I will continue to insist, Speaker, that the promise that the President made was for free universal health care access across the board. And that was a promise that was made to Kenyans when we were being persuaded that those of us who earn a bit more should pay more than what we used to pay at that particular point in time, so that, Honorable Speaker, those who are not able to pay will no longer, will no longer suffer the indignity of having no access to health care. In fact, there was a statement that the head of state made recently, Honorable Speaker, that the Harambes that we used to hold, the WhatsApp groups for contributions to support healthcare, have been closed down. I don't know where the head of state gets this information, Honorable Speaker. Just yesterday, I was trying to call the director at the CEO of the Kenyatta University Teaching and Referral Hospital, because, Honorable Speaker, there is a friend of mine who passed away. He was one of the clergy at the ADC church in Runda. And when he passed away, Honorable Speaker, there was a bill of almost 1 million shillings. And the hospital, and I don't know why, they have refused to release the body, even after the family has pleaded with them. We have written letters, we have made down payments, we have agreed to a payment plan. Speaker, out of that 1 million shillings, SHA only paid 300. So I want the President to know that we are still contributing money to get our people health care. It is the reality on the ground. And you can see, Honorable Speaker, that even the report of a committee is saying even the facilities themselves are struggling because SHA is not giving the reimbursements in good time. And this is true at Mama Lucy Hospital. We have a debt that is owed to Mama Lucy and all the other facilities here in Nairobi, and we're being told the same is the situation in Kitui, the same is the situation in other places like Kiambu. Honorable Speaker, there is still unresolved issues of NHIF, and the report also addresses this, that there's almost 5 million shillings that is owed to Kiambu Hospital. I think the teaching and not the teaching, the Kiambu Level 5 Hospital from the old NHIF. I don't remember which month we were in Naivasha with the CS, but I remember him giving us some timelines within which the question of the legacy debts of NHIF would be resolved. I think as a house we need to bring him back here, because there was reports that he was supposed to give us on what the ministry is doing to address those legacy debts. I have seen complaints about the quality of food in inpatient wards, Honorable Speaker. They have complained about the quality, the portions, even unhygienic presentations, and one that is quite hilarious that the committee noted, or they were told that the food doesn't even have salt, Honorable Speaker. By the time we are discussing salt in food, there's a big problem there, Honorable Speaker, which is why we must continue to insist that counties be given their monies in time and in accordance with the Constitution for them to be able to undertake these devolved functions. The only ray of light, Honorable Speaker, I've seen is at page 29 of that report. For the first time, I'm seeing that at Kiambu Referral Hospital, that they had a properly stocked pharmacy, that there were actually drugs at Kiambu Referral Hospital. They were well stored, well managed, with proper records. And these are the few things that when we see, we feel happy and we celebrate that at least somebody down there is doing something. Because when we visited the hospital in Busia, Honorable Speaker, when we were doing Senate Mashinani, you could see when you are approaching the hospital there is a row on your right of private chemists all along that road. And it is always a first indicator that there's a problem in that hospital. That somehow the systems in the public facility is such that you ensure you can guarantee business for the private pharmacies outside. So I am happy that at least that is not happening in Kiambu Referral Hospital. According to the report of the committee, they have said they also saw digital X-ray that is serving almost 100 people per day that is suspended on the ceiling, and I've seen the photos there. They also reported that Karuri Health Center, Honorable Speaker, is one of the most well-managed facilities they have seen. They have digitized their systems. So we will give Kiambu their flowers for the things that they are doing, and maybe encourage other things, other counties to also follow suit. The story of mortuaries is the same across the country. When we were in Busia, same problem. The same mortuary that Busia has had since independence, Honorable Speaker, up to today, and is in a bad state. Dilapidated mortuaries is a theme across the report, and Honorable Speaker, we continue to reiterate that something has to be done. And when you look at the totality of all of this, Speaker, and then you ask ourselves, is it really true, Honorable Speaker, that our state of healthcare is such that we could be able to deal with any medical emergency in this country? The report paints a different picture. And this is why when Senator for Kitui Wambua was submitting, he said that the concerns that Kenyans are raising about this Ebola facility in Nanyuki is actually a valid concern. We have proposed to the President that instead of us transferring patients from DRC to come and receive treatment here, I think that the US government should grow the capacity of the DRC itself to ensure that that disease does not leave the borders of the DRC, and all of us will be safe, Honorable Speaker. If the money that has been pledged towards this project is given to President Tshisekedi, he should be given that money for him to be able to put up those centers there and be able to contain Ebola within their borders, although now we are hearing reports of even deaths in Uganda, Honorable Speaker. So the state of our healthcare is quite dire, and contrary to what people speak of here in Nairobi and in other public gatherings, they paint a very rosy picture. But the committees of this House, when they go on the ground, the situation that they find, Honorable Speaker, reads like a nightmare, and you can all see in this report. So with those many remarks, I want to thank the Committee on Health, led by the Senator for Uasin Gishu, Jackson Mandago, for this very well-detailed report. They have highlighted challenges, they have highlighted things that they feel need improvement. They have given flowers where they are due, Honorable Speaker, as the case in Kiambu Referral Hospital with their drugs or their pharmacy, and given proper recommendations here. And I think and I hope that once we adopt this report, some of these recommendations will be taken into account and implemented, so that we can give our people assurance that the quality of healthcare in this country is as portrayed by some of the leadership in this country. Thank you, Honorable Speaker.
Senator Sige.